Kiss. Get ready.
Kiss 92.
Let's go.
You're tuned in to The Big Show's Good Morning Doctor, brought to you by Mount Elizabeth Hospitals. Visit mountelizabeth.com.sg today to find out more for all your healthcare needs.
Wake up in the morning.
It's the way Singapore wakes up.
Wake up,
Glenn, Angel, and the Flying Dutchman.
wake up in the morning feeling like
Kiss 92's Big Show.
Good morning, Singapore, and welcome to the biggest and best breakfast show in Singapore. We are The Big Show, and today our guest is medical oncologist from Gleneagles Hospital in partnership with Mount Elizabeth, Dr. Tan Min Han. Good morning, Doctor.
Good morning.
Good
It's great to be
morning.
here.
Thank you so much for coming into the studio and joining us. And this is, of course, all part of our cancer series. And today we want to talk about early detection of cancer through a liquid test. Now, this is what we've been doing is a little bit of research, and we found out that with one draw of blood, you can basically test for cancer. And this is fairly revolutionary, isn't it?
It's incredibly important. Early detection of cancer is something that can really make a difference, and liquid biopsies are the name of such tests. And I'm very glad these are being made accessible to many more people.
Okay, so
There's so many cancers, though.
There are.
So this test will be able to determine all
Types of cancers.
So there are over 100 types of cancer, and this test focuses on 50 different cancers. I think what's important to note is that there are these shared cancer signals from mutated DNA leaking into the blood from the tumor, and this is what such tests pick up. So the shared cancer signal across multiple cancers are what these liquid biopsies detect in that blood draw.
Okay. So you said there are over 100 different types of cancer, and currently what it's called is Lucent's Insight, right? This is the test that it's called.
Yes.
It currently detects just about half of the 100 cancers out there. Will it eventually detect all? I mean, is this something that keeps getting better with time?
So there are many different cancers. Some are, of course, more common than others. These 50 different cancers account for over 95% of cancer deaths today. There will always be, a smaller group of cancers that are
The rare types.
that are less detected. That's right.
Right, okay, got it.
So what are the types of cancers that can be detected through this test?
So this test focuses on, the most common cancers found in Singaporeans and, of course, globally. These include breast, colon, lung, prostate, pancreatic, the combination cancers, including nasopharyngeal, liver cancers. Clearly, this is really important to deliver such tests across a wide range of, diseases and cancers that create so much problems for society and people.
Well, what's
Okay.
your accuracy rate on this?
I think in the population, this would be 99%. The important detail is these allow for the 99% specificity and over 80% sensitivity. We do see these as important that a large number of people can be screened without false positives, because the whole idea is we are all afraid of having false positives in population tests. You can imagine the anxiety being created, the fear, when someone says, hey, the cancer test is positive, right?
yeah.
On the screening, that would be really, really something unpleasant. And such tests allow for a very controlled number of that. It limits false positives, so that's a big advantage of such liquid biopsy tests.
All right.
Okay.
We are speaking to medical oncologist Dr. Tan Min Han from Gleneagles Hospital. We'll continue to talk to him on The Big Show TV. Right now, here's Marshmallow featuring Dove Cameron, Other Boys on Kiss 92.
So this is a single blood draw. I mean, it sounds easy enough. It's not your mammogram. It's not your colonoscopy. It sounds like you're in and out literally in a couple of minutes. What actually goes through the test? What actually happens when you go for this test? And how does a single blood draw actually detect cancer?
Absolutely. So maybe I'll even add on to that question, which is to say, it's not just not just a mammogram or colonoscopy. These are traditional approaches. There is that future of cancer screening where such tests can be incredibly accessible even from home, and we saw that greater access. What happens in this is with that blood draw, we see the DNA and the DNA is extracted from the blood after it's spun down. The DNA undergoes processing, amplification, and eventually genetic sequencing, where the sequencing aims to detect the earliest signals of cancer in that blood sample. Wow. And I think following that, the data is processed using deep learning algorithms, and these cancer signals are returned. The report is returned to the doctor, where the physician can either reassure the patient or, of course, refer the patient for more tests.
Wow. That sounds incredible. I mean, I know, unfortunately, children get cancer as well. Is there an age restriction on a test like this? I mean, could parents want to do it on their babies as soon as they're born just to see if they detect any sort of forms of cancer?
Right now, this is a cancer screening test for adults.
Okay.
So it's for adults above 21.
21. Okay. Got it. Okay.
Yeah. It would be really sad if the first thing a parent does.
Yeah, but I mean, there are parents that want
of
to
course.
know from the get-go, like, how do I handle bringing up this child to become a healthy adult, and you want to know what you're in for as well, right?
Well, I wouldn't do it, though.
Preparation is always key.
Right? I mean, would you?
I think if it's
you had the
available,
option.
if I had the option, I think I would. Yeah, I mean, I'd rather know than not, for sure.
At that age, as in like right after the child is born?
Rather than let it fester and then you not know, and then you find out that you could have done it when the baby was just born. I mean, I would, but to each his own.
Wow.
Anyway, so. Okay, any FD?
A question on our Facebook page. Eddie Tan is asking, when is this test actually done? Is it done during a health screening? Is it done when abnormalities are found in the blood? When is it done?
That's a great question, and this is applicable to people at their health screens. It is something that would be helpful in addition to traditional screening, such as mammograms, colonoscopies. It's something accessible as a blood draw at the annual screen.
Okay.
Like, doctor, okay, so I haven't gone for my colonoscopy yet. I'm going to be 54 this year, so it's high time I do it. But one of the reasons why I never wanted to go for it is because, I hear it's a very uncomfortable process. And so, yes.
No,
Angel.
it's not. It's not, though.
Really?
Yeah, no,
but you've
I mean,
got the drink stuff.
I think that's the only bit that's uncomfortable.
Yeah.
But I mean, the actual process itself, you go in, you come out, you're like, oh, really? That was done because you're out.
Yeah,
You know what I mean?
So it's actually...
You don't feel anything.
Oh.
Even post colonoscopy, you don't feel it. The only uncomfortable bit is the drinking the liquid so it clears your system. That's it.
Yeah.
All right.
That's it. Yeah, but I mean...
I'll go this afternoon then.
No, that's not preparation involved.
And then you like being kind of like... it's not GA, right? I don't... Is it GA?
They put you under, yeah, for sure,
Yeah.
and then they just like count you down 10.
I hear some people like
oh,
that, and they wake up feeling so refreshed and all that.
You actually get the best sleep of your life.
Oh, really?
For that.
Okay,
But-
so it's not so bad.
It's not so bad, but Dr. Tan, like for something like this, how long does it take you to get tested? Like, is it literally like a blood test?
It is a blood test, and the results are returned to the physician anywhere between 2 to 3 weeks.
Okay.
It does. It's not an overnight result.
Takes a bit longer,
and so,
yeah.
That's something which it's important to communicate with to the patient.
So if I choose not to go for colonoscopy and just go for this,
Possible?
is
That's
it okay?
the question. Yeah.
So this is not a substitute for traditional screening. It is something where traditional screening like colonoscopy, mammograms, these have decades of data. Such screening tests at this point are seen as additional to that traditional screening. We do know that maybe 6 in 10 Singaporean women choose not to go for their mammograms. And we also know that for colonoscopies, the compliance is also not very high. I think such tests make the cancer screening accessible to people who may find traditional screening uncomfortable, inconvenient, and these always provide people an additional option.
Okay, we're going to go back on air, but I just want to touch on what you said. It's not to replace, it's an addition But if someone chose to just do the loose ends inside and not the rest of the stuff, is that possible? So we can let's find out
Okay.
on air.
Yeah.
Kiss 92 traffic.
On the TPE towards the PIE at the Tampines Expressway exit, look out for a broken down vehicle. And on the PIE towards Tuas before the Toguan Road exit, an accident situation has been reported. If you have anything else out there that you'd like to share, it's 88550920.
Good morning, Singapore. Welcome back to Good Morning Doctor. Our guest for this morning is Dr. Tan Min Han, medical oncologist, Gleneagles Hospital, and today's session is in partnership with Mount Elizabeth. And we're talking about a revolutionary multi-cancer early detection test called the Loose Ends Insight.
Yeah. So basically, it's a liquid biopsy. And Dr. Tan, earlier on the Big Show TV, you were saying how this is not meant to replace your traditional cancer screening tests like your colonoscopies and your mammograms, but it's in fact supposed to be sort of an additional test. But for example, if I as a woman did not want to go for a mammogram because it's incredibly uncomfortable and painful, could I use the Loose Ends Insight instead?
Absolutely. I think such discussions are always best undertaken together with one's doctor. And in everything there is informed consent. I think mammograms themselves are not perfect screening modalities. They have a sensitivity of 70%, a specificity of 92%. That means 8 in 100 women do receive initial false positives. So I think no single test is perfect. We do recognize a lot of decisions around cancer screening should be individualized. It's important to undertake these decisions together with one's doctor, but Loose Ends Insight absolutely is always that and a helpful consideration.
Wow, okay.
Because mammograms are painful.
They
right?
are very, very
why
painful, yeah.
Women avoid mammograms sometimes.
Absolutely, they're totally painful. Okay, so you talk about the accuracy being extremely high for the Insight.
On the population, yes.
Okay. Do you have a success story that you can share?
So we have not just one, but 3 in the last 1 year, where we have published data showing that out of our initial users, we saw, people who were asymptomatic have the earlier detection of colon cancer, of kidney cancer, and of a blood cancer. And this is published data in 2023, where these individuals have had the benefit of having cancer detected earlier, especially, the first patient had the cancer detected, underwent surgery for colon cancer and was well subsequently. The other 2 patients also underwent treatment. And, I'm just so glad that we can see the benefits of multi-cancer early detection, both for cancers that are traditionally screened as well as cancers outside that traditionally recommended. Because we know today that 8 in 10 cancer deaths actually happen in cancers that are unscreened for.
Right.
And these would include, lung, liver, pancreas, the unscreened cancers.
Right. You know who might... Oh, sorry.
No,
go ahead.
no.
No, you go ahead. please.
I'm just thinking, with this early detection, that would also mean almost completely different treatment for these people, wouldn't it?
And that would be a good thing, to always treat cancer earlier, because it's going to be much easier, much cheaper to manage a cancer that's 2 centimeters in size versus a cancer that's 5 centimeters in size, because the recommendations involving not just surgery but chemotherapy, radiation, it's just completely different. So I would say it's always going to be better to take care of one's screening to make sure we are well positioned for our health and to take life as it is.
Okay.
You know who should probably go for the loose insight right now?
Who?
Prince William.
Oh,
because
wow.
his father was just diagnosed with cancer, right?
Yeah.
So you kind of want to know if
Of
you're
course.
next in line,
Absolutely.
you know, to be king.
Actually, yeah.
Absolutely. We should get in touch with him and send you over there.
That's right. Okay, it is 8:15.
Kiss 92 Time Check brought to you by.
Now
But in
the-
all seriousness,
Yeah.
I mean,
It
it's
would
quite
be-
possible, right, that someone like him would go for a test like that.
Yes, individuals with family histories are really the people at higher risk of cancers, and that comes also, to be fair, together with age. And yeah, I think people at high risk will benefit from having testing that is accessible and easy.
I mean, I think it's fair to say that Lucent's Insight was developed in Singapore, right?
Yes,
Okay. Is it available worldwide or only here?
it's currently available throughout Asia.
Okay.
And today I operate 2 labs, one in the United States where we do provide late stage cancer testing, and one lab here in Asia, in Singapore, where we supply most of Asia. So yeah, I'm glad liquid biopsies, we have been able to do a lot of such work. I think we are one of the 3 companies in the US with US government reimbursement for our late stage testing. And it's just a stepwise process of bringing technology and innovation to the world.
Yeah. Amazing.
Absolutely amazing.
Where do you see this going? I mean, what's the next step? Where do you envision it to end up? I know it's always an ongoing sort of work in progress because you always want it to be better, but what is your vision for it?
I think the wider access to such tests come with the right delivery of services, making things available. I think today, even we are already seeing samples shipped to us all over the world. What does need to happen next is that increased awareness and understanding that such approaches are possible. And this interview, many discussions are key to making sure people know, because it's not just about affordability, speed, access. It is about understanding and awareness. That's really, really key.
And about early detection as
Of
well,
course,
saving
yes.
lives.
That's right. And having that mindset that making things, that early detection is possible, even that's not always something people know. Of course, it's much better now than maybe 10 to 20 years ago, but it's still something that people may adopt a more passive approach towards. I think people absolutely should take control of their health and make these decisions in their best interests.
Yeah. No, this
Yeah.
absolutely cuts the hassle. It's so easy just to
Yeah.
draw of blood and
Yeah, for sure. I
That's
mean,
it,
it's
it's done.
it's really the future of medical technology.
Yes,
Yeah.
we do get a lot of questions about how this differs with tumor markers, where people have used blood tumor
With blood,
markers.
yeah.
I think that there is a big difference in that tumor markers over time create about 4 in 10 false positives, which is to say out of 10 people using this, at some point 4 will have some alarm, and these can lead on to increased referrals and a lot of anxiety, a lot of downstream scans. Such tests that we see here do not generate that large number of false positives.
Yeah.
Yeah.
Will it one day be possible to have this sort of at this level, this sort of cancer screening done together with that same draw of blood that you do for regular blood tests?
It's absolutely something that will happen, and that
Okay.
will come over time with greater access, greater availability.
Wow, okay. So just test for everything. Just go for one blood
One
test
blood
and
test
it
and
takes
they-
care of
yeah.
everything. That would be amazing.
That's absolutely incredible.
yeah.
So if you want to find out more, you can always look under cancer screening on Mount Elizabeth Hospital's website, which is mountelizabeth.com.sg.
Doctor, I just want to ask you, some examples, because I mean, you've obviously had to put out some bad news to some people who have come back and tested, positive. How devastating is, because I don't think we've actually
We've never
asked
touched
a
on
medical
that.
oncologist that, right?
Yeah.
How devastating is it for the individual and the family?
I think receiving a cancer diagnosis is always difficult. It's something that has impact on not just the patient, but also his or her family, because this is where people have, there's the concern about mortality and death. However, I do want to point out that actually receiving a positive result on Lucent's Insight or cancer screening, actually it's a positive thing in the sense that you are actually detecting that earlier,
Early enough.
before symptoms arise, which is something that you can take control of at least possibly months in advance, and it's always going to be have a better outcome than having this delayed. Because if we look at what's the current approach to the unscreened cancers, it's essentially see a doctor when you have symptoms, right? So I think on the idea of receiving a diagnosis, yes, it's never good news, but it's always, if it's going to happen, better we know this early so we can take care of it better.
Right.
How difficult is it to give that news, though? I mean, you talk about receiving the news, but as a doctor, is it emotionally draining for you to do that?
I would say cancer is something I chose to specialize in because it's not just about the science, it's not just about the care. There is that deep appreciation of a spirituality that where we see the interface of life and death, right? Because
Wow.
people care, and this is when we see families respond to this. It changes people's lives no matter what, and I think it's something I feel deeply is important, and it is one of the major. It is the number one killer in Singapore. It's something that we can all make a difference, not just, of course, in better cancer care, but in earlier detection.
Amazing.
That's
Will we ever have a permanent cure for
But-
cancer?
well, that
Can we
was-
ever get rid of cancer?
I think there are scientists everywhere in the world working
Want to
very
do
hard
that,
on that.
right,
I
yeah.
guess we are seeing these advances in many approaches, including targeted therapies, immunotherapies, cell therapies. We are not quite at that day where we can fully cure cancer, but I guess for now, making a difference
It's
both
key.
at the
yeah.
early
Yeah.
stage and at the late stage. I mean, this is all happening.
Okay.
Yeah.
Kiss 92 traffic.
Okay, if you're heading down the PIE, heading to us, look out at Jurong West Avenue 2's entrance. A vehicle's broken down. Also on the BKE towards the PIE, after the Mandai Road exit, another vehicle has stalled there. Wherever you are today, stay safe.
Good morning, Singapore, and welcome back to The Big Show and The Big Show TV. What an interesting conversation we've been having with our guest for this morning, medical oncologist from Gleneagles Hospital. And today's session, as I mentioned early on, is in partnership with Mount Elizabeth. We have Dr. Tan Min Han with us.
Doctor, Glenn was talking about cures for cancer, and I was just reading the other day, there's a drug company in Europe that is working on a cure for melanoma, which is looking really good. Now, that's a skin cancer, so that's somewhere to start. But cancer these days is not that death sentence that it used to be. Am I right?
Absolutely. I think the fear of cancer, stems from a time where treatment was, much less accessible, early detection was much less advanced, and it's really all about personalizing that approach where, 5 different people, perhaps with lung cancer, are treated with 5 different drugs. And that's that personalization we are seeing all across the world, not just in medicine, but in almost every single sphere of our lives. In early detection, I think people all have different needs. People all have their own different family histories and risks. I think that counseling and discussion of what's the best path, this is always absolutely best undertaken with discussion with the physicians, because cancer isn't a death sentence, and taking care of our health is really, really key.
And we always talk about that family history. Here's the question I have. How far back do we go?
Oh, yeah, that's good.
So typically a good family history takes into account what we call second degree family relatives, and that means if we think of myself, up to my grandfather
And your
and
uncles,
my
maybe?
uncles, that's right, and a good history also takes into account not just the family relatives, but also the age of onset of any diseases, and even the children of the relatives.
Okay. So cousins, nieces, nephews. So it's quite a wide
It is.
Very
radius.
wide.
Yeah. But at least it doesn't go back to like 4 generations. It's just 2 degrees of separation almost.
That's right.
Yeah. But don't worry, I say. If we're going to be thinking about this
No,
all
you
the
can't.
time,
You'll worry yourself to
it's-
death.
It's going to affect your life.
would.
Absolutely,
Yeah.
absolutely. Like Dr. Tan said, it's no longer a death sentence. It's more about early detection, prevention being better than cure.
Cure.
We've said this all our lives, right?
Yeah,
And now
yeah.
it's really coming to
Yeah.
fruition.
Absolutely. Well, it's been wonderful speaking to you today, Dr. Tan. Thank you so much for your time. More power to you.
It's a pleasure. Thank you for having me here.
Thank you, Doctor. Well, once again, for more information, you can look under cancer screening on Mount Elizabeth Hospital's website. That's mountelizabeth.com.sg. Or if you'd rather call and get some assistance or get some inquiries in, the number is 6812-3396. That's 6812-3396.
Thank you very much, Dr. Tan Min Han.
Thanks for tuning in to the Big Show's Good Morning Doctor.
Okay.
Lovely.
We're still on Facebook, but we'll go take a photo first.
How long was this in the making? I started the company in 2017, but even then, before that, we had already been doing lab work for maybe 10 years.
It's fast though.
How have you been?
Isn't it?
Actually,
That's
fast.
fast.
Actually, it is fast.
I would have
You know,
thought.
most things
I
take
would
about
have.
3
Yeah.
years.
I would have thought much longer than that.
And I actually started my first blood testing in 2007.
Ah.
But I think our US progress is actually considered very, very fast.
Okay. 1, 2, 3.
Okay, whose alarm is that?
Sorry.
Who's going? It's okay. Good thing it didn't happen on air. Do you need to take? No, she'll send you. Okay, awesome.
Thank you, Doctor.
Thank you very much. Thank you.
Thank you so much.
Thank you.
Great meeting you.
I tried to get Min in here, and he says only under the condition that you come in first. He says what you're doing is way more important than what he's doing. So now he can come.
Now
in.
he can
Yeah, now he can come.
All right.
Okay.
Thank you
Have a nice day.
Bye. Have a good day. Happy New Year.
Yeah.
Happy New Year.
See you guys.
Bye bye. Okay. The puppies are coming in. Yay! Puppy, puppy, puppy. Where are the puppies
Where the
though?
puppies? Where the
Any
puppies?
Oh, no
I'm
puppy.
so sorry.
Nice to
Nice
meet
to meet you. Angel, nice to meet you.
Glenn, very nice to meet you,
Sally,
Sally.
nice to meet you.
Hi, hi.
Steve, my
Yes,
got
hi.
you.
Please sit
Come.
over here.
Okay, sure.
Thank you, Sally.
Yeah, Angel, I heard you just bought a dog.
I just got a dog from Australia from a very ethical breeder
Perfect.
who actually breeds therapy dogs.
Oh,
Yes,
that's so
yes.
interesting.
He's a golden retriever. He just turned 10 months.
I have a Goldie too.
Oh, do you?
Yeah,
Oh my
so
gosh, we'll
really fan
share
here.
stories.
Yes. Of
Okay,
course.
just the headphones on
These
and the
are
mic in
your
front of you.
headphones.
Okay, perfect.
Goldies,
Great.
perfect watchdogs.
Yes.
No.
Yes, they are perfect watchdogs because they make friends with everybody.
Yes,
Exactly.
exactly.
Oh my goodness. Is yours an American or British cream? Ours is British cream.
From Ireland. Yeah, so
Oh,
so
from
British
Ireland.
cream,
Okay,
yes.
nice. Oh my goodness.
Nice.
I feel like I need to get
You,
one.
oh my gosh, you
definitely.
need to get on the Goldie list.
No, I'll get a
There he is.
lab.
Oh, now we're sharing.
Comparing
we're,
pictures,
we're
yeah.
sharing
Yeah.
Goldie pictures.
How do you guys deal with the fur? That's the thing.
It's not called fur. It's
Then?
called golden glitter.
Oh,
Yes,
really?
yeah.
Oh.
When you call it golden glitter, it makes it a little bit easier. Oh my gosh, he hasn't gone into the water yet. How old is yours?
It's about 11 or 12. It's my family.
Years?
dog.
Oh,
Yes,
wow.
Yeah. But still
Okay.
very healthy, so that's a
Okay, that's
thing.
good. His
That's
hips
good.
and everything, all
No
great.
issues,
Oh.
Nice.
Why do they develop?
Yeah, they
issues?
have golden retrievers are known for hip dysplasia.
Oh.
Yes.
So yeah, you just got to be careful. But no, don't look so.
It's amazing that you guys have golden retrievers. I grew up with Great Danes.
Great Danes. Yeah, my grandmother had Great Danes.
Yeah.
They're
Yeah.
the worst, like Great Danes.
Why?
Because they have very short lives. So it's like,
Yeah.
it's so sad.
It
to
is
get,
sad.
Like get
Do
a
they
Great
really? I
Dane.
don't remember
They,
when.
they,
lives
they
are not
do.
that-
You
their
know.
lives are
Bigger
not that
dogs
short.
Shorter, yeah.
Shorter
Yeah.
lives.
So it's like
Okay.
heartbreaking,
Yeah.
I feel
It
if I
is.
get a Great Dane.
Yeah, we had two extremes. We had two dogs. One was a Great Dane and the other was a miniature Pom.
Then the Pom outlived the Dane.
No, one day the Dane got really angry with the Pom, just opened its mouth and went, "Gum."
Okay, going on. Oh dear.
We literally got the tail of the Pom and pulled it out of its mouth, and it was just drenched.
Oh, luckily, a little while longer, he would have swallowed it.
No, he wouldn't
he
have
wouldn't.
swallowed
He
it.
wouldn't.
Going on.
Kiss 92 traffic.
Look out if you're on the TPE heading towards the PIE, because at the Tampines Expressway exit, a vehicle has broken down and is taking up some space on the roads. If you have any news, it's 8855-0920.
Good morning and welcome back to The Big Show and The Big Show TV. Our second guest for this morning is the communications lead at Puppy Club Singapore, Sally Yeo. Good morning, Sally.
Morning. Thanks for having me.
Good morning, Sally. You know what? Puppy Club Singapore, that sounds like the perfect place to work. Tell us a little bit more about Puppy Club Singapore.
Okay, so Puppy Club actually started in Tokyo in 2004 by our founder Yatagai-san. So our vision is to promote the Japanese native breed, the Shiba Inu.
I love Shiba Inus.
I have a friend who has a Shiba Inu.
Yes, adorable. Of course, made popular by the Doge meme. You know, the coin.
Yes, that's right. Yeah.
Yeah, so in 2019, we exported our first Shiba Inu to Singapore. And since 2020, that's when Puppy Club SG was started. So you can find us on Instagram, Puppy Club SG. And we have been, importing Shiba Inus, over 200 Shiba Inus now to Singaporeans who love the breed since then. Yeah.
Oh, so anyone who wants to get a Shiba Inu
Goes to you.
approach
Definitely,
you
yeah.
guys.
So you have them
Amazing.
straight from Japan with pedigree certs. That's very important. They're also registered with the Japanese Kennel Club, and you know that the Japanese, they do things like to the highest order. So everything is in order. You know that they have no health problems,
Yeah.
and that's honestly the ethical breeder that you should be looking for in Japan.
Right. I wonder whether the Shiba will get along with my Jack Russell Terrier.
That's what I was going to ask, because I hear Shiba Inus are quite dramatic and specific dogs. They are not really mixes. Is that true?
It really does depend. So the good thing about our breeders is that they really take note to socialize the dogs.
Okay.
So that's super important, right? Making sure that the dog is socialized from a young age. Right from a puppy, they're meeting different breeds, they're meeting different types of people even, to make sure that they are adaptable to different situations, different scenarios. So you can be sure that your Shiba Inu can play well with other dogs. So you can let our breeders know if you have other existing dog breeds in your house, even
right.
cats.
Right.
Yeah, they get along well with cats, surprisingly. I think all of our clients that have integrated like Shiba Inus into like their current families with young kids, with cats, with dogs,
Oh, okay.
have done really, really well.
Okay.
It's interesting. You were mentioning how Japan is so thorough when it comes to the breeding of dogs and the pedigrees and the certifications and stuff like that. There's so many people these days who talk about don't buy, adopt.
Adopt, don't shop,
Adopt, don't shop. What are some of the misconceptions that you really want to dismiss when it comes to this?
I think that phrase has been lengthened to in a way make it more adaptable to the current situation. It should now be adopt or shop responsibly.
Okay.
Oh, right. Okay.
Because with adoption, there comes with it, its own host of issues that you need to deal with. Because certain, like we have met certain families that have tried the adoption route, but then came to us eventually because either they want a very specific breed, or they want a very specific age of the dog that would fit with their family, right? And often adoption, you might not have that kind of benefits of being able to know the pedigree, knowing any prior health problems, things like that, and that can be very daunting for like a first-time pet owner, right? So that is the direction that we're going towards, to shop responsibly instead, to also lower the return and abandonment rates, because a lot of adoption agencies, what they see is that people they think that okay, I can do it, and then they take a dog, I can't do it anymore. Too many health problems, she snaps around my kids, things like that, and then they have to return them, or worse, abandon them to the streets, right? So that's why both, I think, adoption agencies and responsible pet shops and breeders, you need to handhold, like us with Puppy Club SG, we handhold our owners a lot. We make sure we're not just like throwing the dog at them and then just leaving them in the blind. We make sure that they know exactly what to do. If the dogs are like misbehaving, what we can help them with to ensure that they do not return the dog or abandon the dog.
So there's like a support community after sales club.
Exactly. Yeah.
Okay.
Right.
We are speaking to Sally Yeo, Communications Lead at Puppy Club Singapore. Let's continue to talk to Sally on the Big Show TV, okay? Meantime, here's Sabrina Carpenter with Feather on Kiss 92.
I just want to ask, because a lot of people also say adopt, don't shop, because there are a lot of puppy farms.
Yes.
And there's a lot of unethical breeding with the way dogs are impregnated.
Yes.
How can you sort of allay those fears to someone who, for example, wants to buy a Shiba Inu, and how do you just put away those misconceptions?
Okay, so
Or at
my
least,
recommendation is always two things. First, you need to have the papers. So the certifications are very, very important. I think that adds an additional layer of like, we know where this breed is from, we know what his pedigree is, we know his parents, we know everything that you can know about the breed. So that's one thing that all of our puppies come with, certification. Secondly is you have to see the parents. So I'm going to contrast this later with, unethical breeders. But with ethical breeders, you always see the parents. That's super, super important. So for us, like the puppies' parents are based in Japan, so we have like video calls, videos with the parents, so you can see the parents like day-to-day lives and how they react, and you can have a better idea of how the personality of your dog will be. In contrast to these unethical breeders, sometimes you just meet them.
There's
like,
no trace.
Yeah, at like a HDB, and then they have like, a lot of dogs. Yeah, I've had.
Oh, really?
Yeah, I think I have friends who unfortunately were uninformed, and, they weren't able to go to like ethical breeders. They just thought like, oh, this was normal, people do this. And then they breed at home. They don't have visibility on the parents. They're like, oh no, the mom is with somebody else, or like the dad is with somebody else. This is only the mom, and they don't have any papers, right? So no papers is always a red flag, because you literally don't know, how the pedigree was
The
formed.
DNA, the history, yeah.
Exactly, you can't track, and that a lot of people don't realize how important. They're like, oh, I'm not showing my dogs for awards, right?
Yeah.
Like, why do I need a pedigree dog? It's not about it. It's the health of the dog. So it's actually like a form of animal cruelty to bring dogs into the world when there's a high chance that they might have like hip dysplasia.
Yep.
They might have health problems. They will struggle with this their entire lives, not just the family, but
And then you don't know where it's coming from.
Exactly. So that is like the bad thing about unethical breeders, where they are not looking after the health of the puppies that they're bringing into this world, and then bringing a lot of issues and diseases with them into this world, and that's why they should be clamped down on. So we should not support those unethical breeders, even if they're much, much cheaper. It's just bad for the dogs. Exactly. Yeah. And long term it will cost you a lot more in terms of like medical fees,
Right.
things like that.
Yeah.
Does this mean the authorities are not doing enough? Because I think they should definitely work harder to stamp this out completely.
The puppy farming and
Puppy
stuff. Well,
farming
they
and
have
people
actually.
who breed from, as you said, from their
Houses.
private residences,
They-
and there are many people like that.
They have clamped down on it. I know a lot of puppy farms out in Pasir Ris shut down. They were around for a long, long time,
Okay.
where you could just go there and just pick a dog and
Yeah.
stuff like that. They've shut down, and I'm glad you said that, because my tofu as well. I know his parents, Lucy and Groot. I know their whole bloodline. I know his grandparents. He comes with papers as well, and me as well. I was always like, why do I need a pedigree? But now I know the reason behind it, because you can trace that DNA.
Does that then make more sense then to buy from these overseas breeders like you did?
Yeah, I did.
Does it make more sense then?
I think there's definitely a case for like local, like for example, we are considered like an overseas breeder because all of our pets are from Japan.
And there are overseas breeders who are puppy farms as well.
Exactly.
Yeah.
So you don't know.
Exactly.
So you got to be careful.
You gotta be careful. Like for us, I mean, we did the whole video conferencing. We saw all the other puppies. We chose the one that we thought was the best. We saw the mom and dad as well, who lives with the breeder.
Yes.
So she had a long line of customers. I hate calling them customers, but new homes.
Families.
Families
Yeah.
that had so much good to say about this breeder. So
Perfect.
Yeah.
Yeah.
But you
That's
know, the
important.
activists who are
Yeah.
who want people to adopt
Don't
are
shop,
not
yeah.
going to buy this, right? As
Yeah.
in, like, because they feel like, okay, these dogs have been abandoned. A lot of them are not,
Yeah.
what do you call, in good shape and all that.
But it takes a
What
special
they-
someone to look after dogs who are not in good shape.
Yeah.
as well.
Exactly.
exactly.
So, like what we said in the beginning, I think it's not fair to begin with. to force everybody to adopt.
To adopt, yeah.
You know what I mean?
Yeah.
But if you decide not to adopt and you decide to shop, then you shop responsibly.
Responsibly. Yeah, like I felt like
Yes.
almost like a bad human being shopping for a dog, but initially.
Yeah.
But now
it's
you've
the
sort of
whole image.
It
It's
is.
been given
You
a
know what I
bad
mean?
name.
Exactly.
Yeah.
So when you go to a shop and you buy, then people look at you, hey, why didn't you adopt?
Yeah.
But it's not fair. It's
But
not
so
fair,
okay,
yeah.
so for example, I mean, put puppy club aside. If someone were to walk into a pet shop, because a lot of people do, and they want to buy a dog, or any other animal, what should they look out for?
Okay, like I mentioned the two things,
Yeah,
right?
just the certificates?
The certificates as well as the parents to make sure that you can see the parents.
Okay.
So a lot of them, if let's say they are imported from Ireland, very common, make sure that you can, video call their breeders.
Even as pet shops here, they will allow
should
it?
be able to.
Okay.
Yes, that's the thing. So there's a difference between like ethical breeders, ethical pet shops, and license. So think about AVS. I think you mentioned a little bit earlier about is there like a lack in the what AVS is doing? Possibly because at AVS, what they do is they just ensure that licensed pet shops have like vaccinations, deworming, but they don't care about the history of the dog. Yeah, the pedigree, the papers, right? So that is the thing that actually impacts some of the hereditary diseases that they have. Yeah, so whether yes, they might be licensed, 100%, that's great. But I think there should be the additional step to ensure that they are ethical. That comes with the papers and the pedigree. Yeah, so that's the important part that I think a lot of people are not aware of, and that you can actually do it, and we hope to debunk the myth of like shopping is bad. No, it's not. It's it's about what adapts to your family the best.
Yeah.
What is the choice that's best for your family as well, because we want to breed dog lovers, of course.
Yeah.
We want lovers, and you can always go for like for myself, my first dog, my family dog is a golden retriever. Now I foster because I have the experience,
Yeah.
so it's a little bit more adaptable for me to be able to have an adopted puppy as opposed to like somebody who's brand new, knows nothing about puppies, and then they are like going straight diving into SOSD. It can be a little bit overwhelming for them.
And sometimes, I mean, that's a very, very good point because, I mean, case in hand, like when you got tofu, for example, I mean, it was difficult at first.
Yeah.
It was extremely difficult, and not everyone, for example, who gets a new puppy will be able to handle it.
Oh my gosh,
Sometimes if they don't have the support that is needed, especially when you
Exactly.
get a puppy, then your whole life, is turned upside down.
Buyer
So
remorse.
what happens if you come across someone who's gone through you guys and gotten the puppy already, and after like 2 or 3 weeks decides, no, this is not for me.
We were about to resell him. No,
There
I'm
you go.
saying- no, because it was so difficult. It's like having a newborn.
Yeah.
Obviously, you can't return.
Yeah,
Your child
exactly.
or your dog, and you shouldn't. But it was very difficult
Very
because
overwhelming.
it's like what do you do?
But this is what I mean, you see.
Yeah,
I
buyer
mean,
remorse,
If,
yeah.
if it was only after like 2 or 3 weeks that you've gotten the puppy and you decide at that point, like, oh my goodness.
You're
it's
tearing your hair out,
This
he's
is
destroying
this
everything.
is not working out for
Yeah.
me. Can they return it? Or can you guys look for
A new home.
someone, a new home for it?
Well, thankfully, I don't think we have had any issues with that.
Good.
I do feel like the Japanese, they have a very interesting way of, bringing up the puppies from young as well. So they kind of like, they really take care to, like I mentioned, socialize the puppies to make sure that they actually are already obedient when they come over. And also because in Tokyo and in Singapore is very similar kind of city
Puppy
environments.
trained, they're toilet
correct.
trained.
Yeah, so they are toilet trained, they're apartment trained, they know not to bite like wires, things like that.
Oh,
yeah, so
okay.
it is I would say that getting like the kind of pet shop that you're looking for, also ask them like what is the hand holding period, like how much will they support you, how well behaved is the puppy already when it's coming to you, right? So that's one thing that I feel like the Japanese do really well. So like in for us, Puppy Club SG, we do make sure that the puppies are well adjusted before they go to their owners. So far no
so
complaints.
far so good.
Yeah, so
okay,
far so
Oh, that's
good.
very
great,
good.
Yes.
great.
Okay, we're going to go back on air. Stand by.
He took me back to East Atlanta, Oh, my heart is in Havana. My heart is in Havana.
Camila Cabello featuring Young Thug, Havana, right here on Kiss 92. All the great songs in one place. We are speaking to Sally Yeo from the Puppy Club Singapore. Good morning, Sally.
Hi, good morning.
Good morning. So we're just talking about how you work together with Puppy Club Japan to make sure that new families in Singapore get the best kind of Shiba Inu puppy. But as a whole, we're talking about how to get the best kind of dog for your family.
That's right.
Not just Shiba Inu.
Not just Shiba Inus. Yeah. In terms of how you work with Japan, do you bring puppies in only when you find them a home, or do you actually have puppies here for people to go and look at?
No, that's a great point. So we only bring them in when a client has adopted or selected their what we call a love puppy.
Okay.
So the puppy that they love, right? So we only bring them in once we have a puppy that they have selected, right? So that's different from other pet shops in Singapore where they actually bring in the puppies and then they hope somebody would take them home, right? So that's a very good way to also curb like overbreeding, right? You're not like you're matching the demand to the supply to make sure that we're not bringing in puppies that might not have homes, might grow a little bit older, then it becomes more and more difficult for them to get homes.
What's the quarantine period bringing
From Japan?
From Japan.
From Japan, because it's one of the best countries. If
Category
I'm not wrong,
A?
yeah, category A. So it's really quite short. At the same time, it's something that's handled like from start by us. So you don't need to worry about all like the documentation.
okay.
So there's no
Yes.
quarantine.
Yes.
No
There's
quarantine.
no quarantine.
Just like
Okay.
Australia.
Australia.
Like rabies-free
That's good.
countries.
I think
Yeah,
Ireland
that's
as
good.
well. Yeah. But
That's
okay,
really good.
so you said, I mean, the key to getting a proper ethical dog is to make sure you know the mom and dad. They have their papers, they have their certificates, and all that.
That's right.
Would that also work for going into, say, an HDB flat where the mom and dad live and they have a litter? Is that okay to go and buy a puppy from something like that? You know what I mean? Because you
yeah.
have the trace of its health.
Yeah, I would say I think the papers are really important. So a lot of these kind of backyard breeders, they might not have the
Backyard
papers.
breeders,
Yeah,
okay.
because they don't even know where their dogs came from. Like they could have gotten them, from anywhere. Yeah, so I would say that regardless of the place that you're getting them from, two most important things: papers and the parents. So
Papers
papers
and
and
parents.
parents. I think that's really easy to remember.
The triple P, puppy, papers, and parents.
Papers and pens.
I mean, for owners right now who have dogs with no papers and all that, I mean, continue to love.
Of course, of
Yeah,
course,
of
yes.
course.
Yeah, don't look at your dog right now and go like, uh-oh.
You're paperless.
Yes.
Out you
You're
go.
inferior. No. Love your pet with all your heart.
Absolutely. I
course.
mean, I had a mongrel which we picked up from the street when we were growing up, and
Yeah.
she turned out to be the best dog ever.
I had a couple of
course.
mongrels as well.
Yeah,
You
so
know, and they were wonderful.
Singapore
Wonderful.
specials now. That's
Singapore
what they call it,
specials,
Singapore
yeah.
I was
So it's like,
born a
Paria.
mongrel.
Paria dogs.
Paria dogs. Paria
dogs.
sounds so
Paria
gangster.
dogs.
Paria dogs. Yeah. We had some friends who were parias.
Yes,
as well.
really.
Kidding. All right. Well, we've been speaking to the communications lead at Puppy Club Singapore, Sally Yeo. Thank you so much, Sally, for joining us today.
No worries. Thank you so much for having me.
And if
Yeah.
I want to order a Shiba Inu, I'm going to go through
Come
you.
to
Okay.
us, yeah.
Oh, yeah. One thing before I go. What is a Mame Shiba Inu? Is it a smaller breed of Shiba Inu?
Mommy.
Mame.
Mommy, have
Yeah.
I've not heard of
Not
it.
heard of that.
It sounds like a
Mommy.
mix.
Yeah.
Mommy,
Some-
Shiba Inu.
Yeah.
Okay.
I have to check with, yeah.
Okay.
Yeah, if you want to get in touch with Puppy Club Singapore, you can go to Instagram. It's Puppy Club SG.
The only way to get out of bed.
Glenn